Hello and welcome to another episode of We Care Conversations, a fun podcast brought to you by the Mental Health and Recovery Services Board of Allen, Auglaize, and Hardin counties. I'm one of your hosts, Cody Ridenauer, and I'm joined by my co-host.
Elisa Bradley.
And today we have some special guests.
That's right.
A number of guests, so it's a big episode. We have Tammie Colon, the Executive Director of the Mental Health Board.
Yeah.
Say hi, Tammie.
Hi.
You're supposed to say hi, Tammie.
And we are joined by, you want to introduce yourselves?
Yes. Logan Foley, school social worker for Bath Elementary.
April Neff, the school counselor at Bath Elementary.
Cool. And thanks for coming on the show.
Thank you.
Thanks for having us.
Yeah. So it's a unique episode today. Tammie, you want to give some background on how today's episode came about?
Sure.
Yeah.
So again, as I've been saying, I'd love to take credit for today's episode, but it really is a result of these young ladies who approached the board about our willingness to put something out in whatever platform we could to try to help inform the children on what to expect should they want to receive services by any of our community agencies, and equally important, the parents. They hear they're talking to the parents and they're talking to the kids, so they know what their experiences are, but they're also professionals and understand that sometimes things in the heat of the moment can be misconstrued, misunderstood, expectations can be out of order. And so we wanted to do this episode to make it available to the public, but also for the schools to be able to put it on their website, make it available to their student population and parents to try to help bring a real, true understanding of what to expect.
Perfect. So yeah, ladies, you're hearing a lot of the same questions, I bet, over in your line of work. I'm sure you've heard many of the same questions, Lisa.
And I'm happy that we're doing this episode. It's good information, and a lot of our schools will benefit. Awesome. Good stuff.
So we're going to dive into some questions that you have given us and see what kind of answers we get.
Sure.
This will be fun. Okay, so obviously school counselors and social workers are kind of a short-term solution to maybe a larger problem. What are some of the things you're seeing, like at Bath schools and probably universal in all the schools in the 3 counties that we represent? Just some common things that are happening. Yeah.
I'd say some of it is just behavior challenges that kids have, and then parents also see that at home as well. So it's kind of us all trying to work together to help a child. Can be some of their just emotional things they're going through if they're dealing with different life situations that they need some help navigating, or the parents need help helping their child with those. So there's just some things. And
we're also seeing a lot of kiddos with anxiety, stress, like with schoolwork, and just helping them with, coping skills to help them navigate that through school.
How would parents know that it's time to get some help, whether it's through the school or outside of the school? This is open to all 4 of you because you're the experts here.
I feel like I'll tell parents if they're having a hard time supporting their child or knowing how to support them, that's a good time to reach out and get more support, even outside of the school.
And I would add, when there's a behavior or a situation that you are completely unfamiliar with, we also want to remind parents it's okay to ask for help. Oftentimes there's no real handbook for parenting all the time. And so in this busy and changing time, there's situations that parents haven't encountered before. And we're a community that cares, and so they should reach out.
Yeah, I think anytime a person has the thought, I don't know what to do, I've tried everything I know how to do, it's time then to ask someone else, right? You've exhausted all of your resources, and starting with the help that the school has available. And while they're school personnel, and sometimes in my experiences, there's history with parents and their feelings towards school systems. But when you're talking about the navigators that we have in school that are not school personnel but funded by the board to be supportive to students, and you're talking about school counselors and school social workers, they're employed by the school, but their goal is the youth, right? They're on your side. They're there to cheer on the young person. So that is a excellent opportunity. Every system then has one resource because it's in their school. It's the first place you should start when it's dealing with your young person.
Yeah, I was gonna ask, where should they start?
That's where I would have started, and it's where I did start. So, I'm a parent. I've had a child. I've had concerns that when the light bulb went on and I was like, look, I'm really concerned about him. The school is the absolute first person I reached out to. They have them more hours in the day than I do, right? And lots of eyes on him, and I wanted to make sure that he was well cared for and that the people knew what my concerns were. So the school is the first person I contacted.
Let's talk a little bit about maybe some outside school resources that aren't quite, full clinical, maybe church groups, things like that. What are some advantages there? Is that an option for parents? And then I guess when do you know that it's time to talk to the school counselor or social worker and maybe go beyond that even?
Go ahead.
Well, the school, the staff that are in the school are there to respond quickly, right? I understand they're not there in the summer, so that leaves some families at risk over those holidays and summer times. But they're there. They're there 5 days a week. Anytime you have a concern, you should call them. You should also value their opinion. If the situation doesn't appear to be able to be resolved in the short period of time that they have to offer support to the young person, or if it requires therapeutic treatment, then you need to seek outside resources that are in the community, available to the family all year long for the rest of their lives, even into adult lives. But more importantly, to be evaluated. Yeah, to make sure that we're not missing something, that we're not just responding to a symptom, but we're missing the real condition.
So are you finding that some students need maybe the next step? I think that's kind of why we're here today is to talk about that. I see that one of your questions is there a comprehensive resource? So are you getting a lot of questions? Maybe it's past your time. They need to move on to
Mm-hmm.
something a little more intense.
Yeah. If, a parent knows that they need, outside help. I have a list of local resources that, I give to parents and then they can make the decision which place would best fit, their child. But even having something online would be nice too, where like go to this website and then you can find all the local resources. Would be beneficial too.
Yeah, and very difficult to do.
Yes,
Right.
yes,
Yes.
yeah.
And that's what these young ladies are telling me is it's not an easy task. Well, it feels easy on one hand because you can get on and Google, and there's 100 million things that are going to come up, and you can select down to your local communities, but it's still not informative enough. And agencies come and they go, programs come and they go. So keeping up a resource that's readily available and informative to families is very challenging. We've tried it over the years, and there are resources that I can mention at the end that are legitimate. The Ohio Department of Behavioral Health has a find help locator, which can zero in on your community. But what I say to people is call the Hope Line. They're the one resource that is meant to be, that is their charge and responsibility is to stay on top of things as much as they can. And that is in regards to our local resources. And they carry the information on whether this particular agency takes Medicaid or whether they take private insurance. And then um, whether or not they offer a particular service that the young person may be in need of. But it's hard. It's very hard. And so using our local resources that we have available, our school personnel and the resources they've been able to collect. But is there a one-stop shop that's going to speak on behalf of Allen, Auglaize, and Hardin County? No, it's an impossible task to manage, unfortunately.
I'll add that I'm thankful that it's a human person who is answering these calls. And I've had that question before also. I don't want a recorded line. I don't want to press one. And so I'm thankful that it's a live person in this area who's answering those calls.
And if they don't have the answer, it's a live person that's going to do the research for you and get back with you because that's their charge and responsibility.
So yeah, I think maybe a misconception is the Hope Line is only for acute, critical, really bad situations.
Right. It's actually an information referral line as well. So yeah, I think to your point, that's something that we don't market enough is that you can just call and ask any simple question.
I hear you.
Oh, did I say that to you? Sorry.
We say it a lot, but clearly sometimes not enough.
So does that kind of help with where you can guide some?
Yes. Yep.
Yeah.
Absolutely.
Yeah, I think initially we, we'll offer resources, encourage, and it's, it's not as easy as looking up, looking on the list, and there's a lot more digging and questions that parents have to ask.
Yeah, there's
So-
so many questions. Who's in network if I have third party? What's my deductible? What's my copay? There is a state organization that I'll list at the end of this that can help families that do have third party private insurance if they call how to navigate their insurance. They're also monitoring to make sure that parity is in place and that insurance is offering behavioral health support because it's required to do so, but we still run into barriers with that, right? And then we'll get sometimes, I know they have indicated that families will ask, well, I have insurance, but I can't afford the deductible and I can't afford the copay. And neither one of those should stop a person from being able to seek treatment from agencies that the board has a contract with, right? We don't have a contract with everyone, so that's another confusing piece, right? We don't have enough money to contract with every provider that's available in our community, but we do contract with certain agencies and we do to assist with hardship cases. So and you have to ask though, right? So you get the secretary at the front desk who sometimes is just processing you like they process everyone else. You have to share, I can't afford this. What assistance is available? It's just like when you go to a hospital or any other medical provider. It shouldn't be the barrier. It should be the conversation about do I still get this for my child and afford to be able to give them what they need. Our contract agencies are on our website. So if anybody is in that situation where they have third-party insurance, but they already know, despite that, I can't afford treatment, you can go to the board's website and the agencies that we have contracts with where we funnel money to assist financially to families with or without insurance. It would be available to them at a cost they could afford or no cost.
So are you hearing from a lot of parents, like, we can't afford this, we don't know how we're gonna pay for this, a lot of misunderstanding?
Yep.
Affordability comes up.
Yeah.
Definitely. Yeah.
Yeah.
And that breaks my heart because the last thing we need to do is let that stand in the way between a young person getting their needs met. But oftentimes it's probably a bit embarrassing and unfamiliar territory, and families just don't communicate that they need that help, and then they just either don't go or they drop out of service after they get that first or second bill. When all of that can be managed, the last thing we want to do, that's why we have a levy. That's why our local taxpayers vote. That's their contribution. Those families are contributing to that care, but just differently through their tax levy, right? So they are paying for that care, and we have ways in which they can, exercise that.
So that's a space to talk about how we can educate our parents for advocacy, because that's really what we're talking about, is how our parents advocate for, and they can ask for things like if it is a little embarrassing, which we all know it is, to say I can't afford something. So the language revolves around asking for financial assistance. When you're calling that agency, is there financial assistance available? Are there, sometimes it's grants, sometimes it's a small amount of money that agency has that can help with these types of situations. So the language for the parent is to ask for financial assistance. That's the language to ask when they're calling that agency. Is there financial aid available to help these costs?
Yeah, again, because not everyone will have it, but some of the agencies will.
And that sounds not that embarrassing.
Absolutely. Yeah, to ask for financial assistance as opposed to saying, I can't afford this, which, some parents are confident and okay with saying I can't, but sometimes some parents need some different language. And so the language is to ask for financial assistance.
Well, I think just giving them the permission to ask. Like,
Yeah.
Yeah.
Encourage.
encourage it and say, here's another way to get what you need.
Yeah.
And there are a lot of agencies, even without our funding, that'll set up payment plans for families. The problem is it goes unknown. It's never talked about. And so then the child doesn't get what they need. The organization didn't know the family needed more assistance. They were just processing them like they do the majority of other folks that come through the front door.
And then sometimes hindsight's, 2020, like the agency's like, we didn't know that you needed help. Let's change channels and let's go this route. And then sometimes that can lighten the burden. I've been in that situation where, again, they didn't know that they could ask for an extension. They didn't know that they could ask for a payment plan. They didn't know what they should be asking for.
So I think along with that, you hear a lot about Medicaid, Medicare, sliding scale fees. Yeah, I want to explain that for the three of us that maybe are less educated on that. Yeah.
So a sliding scale happens when you take your family's total amount of income and then you kind of prorate it to what you can afford. Maybe I can't afford $125 for each session, but I can afford 50. And then that's the conversation. Many agencies will try to have a policy or a process in play, but sometimes they don't. And again, it's about advocating for your family's needs and asking, I can't afford $125. I can't afford $85. If there's no financial assistance available, can I pay less?
Gotcha.
Yeah, and if the answer is no, then you go somewhere else. Because at the end of the day, there are agencies that have it available to you. You just may not have struck the right one on your first try, but it's worth the second phone call or the third phone call. Because if you're making the call, what I can assure families is the situation will not get any better by not making the second or the third phone call. So you're just prolonging and potentially allowing the situation to intensify without just it's a search. It's you go looking for a dentist. You don't always get the right one, you go looking for a family doctor. It's a search. You got to find the right agency that's fit for you, fit for your family, fit for your circumstances. And that can be taxing, but it's necessary because at the end of the road you will get what your young person needs.
I also like that many agencies, when on the phone, they'll say, well, maybe we don't have that, but call this place. So they can also kind of forward you along in that process as well. And that's helpful because, you don't know until you ask. And so we just want to encourage folks to keep calling, to keep asking. And it is tiresome sometimes, but as Tammie alluded, we got to keep, it's your child and it's your
Yeah.
family's well-being. And so we want to encourage to keep asking.
And Medicare is a difficult insurance in behavioral health because it is when you compare Medicare coverage and Medicaid coverage, they're nowhere in the same ballpark. Medicaid for behavioral health is a great health insurance. It covers services that third-party insurance does not cover. So I'll give you an example. Sometimes families need what we call case management, right? That means they need someone out there going into the school alongside of the kid, taking them places to introduce them to pro-social activities, really doing skill building. So we call it case management. Case management is covered by Medicaid because our state recognizes the value of it in getting people well. It is not covered by Medicare, and it is not covered by third-party insurance. So for families who have a child that has an enormous amount of needs and they have third-party insurance, they're likely still going to need to go to an agency that the board contracts with because that third-party insurance is not going to provide for case management. So the board is going to pay for it. It is not going to pay for a dependently licensed person to do a group. So the board is going to pay for it so that the young person can get it. So this is where that insurance world gets very complicated. I would say at the end of the day, Medicaid is the most, it is the best insurance to have in the behavioral health field. But the challenge with that is not everybody takes Medicaid.
Right.
We got a lot of private agencies who are doing amazing work, but they're not taking Medicaid because you got to jump through a lot of hoops to become a Medicaid provider. And the reimbursement is not as good as third-party insurance. So we got a lot of private agencies who choose to be cash only or third-party insurance only, but they can't provide the holistic resources that a young person with multiple needs requires. So you have to go to an organization that has all of those services available and paid for by another health insurance, which is the board, if your young person needs it, which is why I really say call the Hope Line because they are trained to walk you through all of that to try to direct you to the best provider. And they don't want to direct you to public services if you can have your needs met in private services with your private health insurance, right? We try to protect the public service because we're taking care of a lot of people and we take care of the sickest people in a community. So if you've got insurance and we've got a good provider that'll take that insurance and you're not going to need those additional wraparound services, that's where they're going to drive you. But if we believe you're going to need more than what you can get from a private outpatient practice, they're going to drive you into the public system that has those wraparound services and they're paid for.
I guess what I'm hearing though is there's a solution somehow.
Right.
Yeah. And they can always call the board. I mean, we then are the last resort, right? We pay someone to do that work if it's in front of us, but you're hiring people and sometimes they don't do it as well as families need it done for them. And so the board we take calls all the time. You can email us through our website. If you ran into a situation, you have a question about it or a bad experience, we follow up on all of that. And we're here as a resource as well to try to guide people to the right space.
How does that make the two of you feel? As you feel a little more prepared to talk to some of your families? I mean,
Yeah, more or less like just the different steps that they can go to and just knowing if we don't know where.
Right. We can direct them to
Yeah.
the Hope Line number. We can direct them to the board.
Yep.
Or they can email. They can at least
Yep.
get some questions answered and get some direction.
Yeah.
So
maybe you can focus more on the care with the student right then.
Right.
And know that there's this,
there's more support for us out there too
Yeah.
to help
it's hard
support
for
them.
families.
So yeah.
It's hard. I guess that's mostly what I want to just keep saying, and I do it probably every time I get behind this microphone. It's a hard system. It's complicated. Just don't give up. It's not going to get better by giving up. So don't give up. Keep plowing through. Call the next person. Call the next person. Email the next person. We're a public organization. I have a responsibility to the community. That's who I work for. Walk through the front doors. We're at 528 West Market Street, right? I mean, we are who you should in the very last resort reach out to try to get your needs met, and we take that very seriously. But I also understand how hard it is. I got insurance, but my kid has Medicaid, but I have this Medicaid, but my kid has a different Medicaid because now we got Ohio Rise that it exists in our world, and that's complicated for families to maneuver. That's two different Medicaids in the same household, and each Medicaid plan offers something different. We've made treatment very challenging.
Yeah. And that's what I've heard in some of my public conversations is, Lisa, this just shouldn't be this difficult, but this is the system that we have. And again, we're going to encourage you to keep calling and to keep finding those resources. I was speaking with a private provider yesterday in preparation for this conversation. And what she wanted to make sure that our families know about is that oftentimes there are groups available. I know that there is a courageous parenting group that's available, which is also highlighted on the board's website, and that also come out through the board's e-text messages that go out to the community that can inform folks about that. But Courageous Parenting is provided by Mission of Hope. Those courses are free, and it's an information place where you can find out about what's happening in the community. You can also find out some tips and tricks to do for your families and for your children in regards to parenting in the different age groups. So that's a resource as well.
Yeah, we got a lot of great small practice providers are doing good work. They go after grant money to be able to do, charity work as well. I mean, they're not all coming to the board for funds. But it's a search.
Yep.
Yeah. Well, it's good to know there's the Hope Line and the board itself to find some of that I want to switch over to kind of the day to day. Some schools have school navigators, some schools have more or more resources as far as social workers and counselors. Um, can we explain maybe the difference between a school navigator, a school social worker, a school counselor?
School navigator, we have one through Safi. She helps with brief intervention. Can do 6 visits, and she's wonderful. And she yes,
That's
and, contacts the parents, afterwards that when she met with the kiddo and just really helped with those short-term brief interventions. My role, school social worker, I help a lot of kiddos with the behavioral, emotional, social, needs, and also helping connect parents to outside resources as well.
yeah. I'm out at our school navigator. If our kids are going to see the school navigator, we have a consent that goes home to the parents to sign, or they can send it electronically to get consent that way. So, and they can also help parents connect to resources like after their brief intervention. Do we need more counseling? Do they need something else? And they definitely communicate well with the parents on that. So that they're kind of a resource for us because in this busy world, they can help and
Yep.
help. We can help more kids this way. In school counseling, I mean, I'm doing classroom lessons where I'm helping kids with social, emotional, behavior things, academic support, organization. So there's kind of a large gamut of topics as well. Behavior.
Sort of layers.
Yes.
We wear lots of hats.
Yes. So
yes.
we sometimes do lots of similar things, but we can help more kids with there being 2 of us. Yeah, some more brief interventions as well, like Tammie was talking about in the beginning. We're there, we can see kids. We might see and hear things going on from the teachers in regards to a student, their behavior, whatever, their emotions, things like that. But, we can't serve every kid long term, in that school setting. So, yeah.
Yeah, so and they're not going to diagnose and do what we call therapeutic interventions, right? They're doing support and counseling and behavioral mod and skill building. But and all of that's important and many kids get better with just that. There are a select group of kids that are going to need treatment. They're going to need to be assessed and evaluated to determine if they have a mental illness. And if so, how we're going to treat it. And that's going to be done one on one, likely in an office. Now, the navigator, the other reason we put the navigator in place, and it's been one of the best things we've done in a lot of years, is to try to help these folks. And we say to the school, the crisis is defined by the student and the school. Like, that's just the way it is. So if Joey comes to school today and his dog died last night, that he's distracted and he's upset, the navigator, if they're available and they're there on that day, let them just talk them through it. The more we get kids talking and having someone to hear what they're saying, and we teach them to process and to really deal with the emotion at the time, and then they can let it go like the rest of us. We call our friend, we complain to our husbands, our wives, we and then we're over it. But we processed it. It's all of this repressed events that kids don't have an opportunity to process through that just layers on top of it. So, and you can only imagine there's 2 of them and all those students in the school, right? So the more soldiers we can get into the school to just listen and then direct, that's the goal of the navigator. And schools can't afford to continue to hire staff, but the board, again, using our local tax dollars, this is something our community has said they wanted for years, is more support in the schools for the youth, and so that's where we invest the dollars.
As a parent, I might have questions of what's going to happen, in this appointment, or if my kid goes into the counselor's or social worker's office. So I guess I kind of want to look at those layers of what happens when they come to you. What does that sort of appointment or discussion look like? And then Tammie and Lisa, what if they need that next level with the therapeutic, the therapy? What do those appointments look like? Parents, a lot of parents don't have experience with therapy or having this done, so they're worried about what they're gonna say to my kid. Is this gonna be super intense? What's this gonna do? So yeah, I guess I kind of want to go through that level of they're at school, they meet with one of you. What does that look like? And then if they need to move up to something more intense, what does that look like? Yeah.
I think it depends on the
Yeah,
situation for what it looks
definitely.
like, because there's a whole range of things we may
Yeah.
talk to a student about, and it may just be a brief conversation, if it's a student conflict or if it's, maybe something's going on that day and they're feeling down or they're sad or something's happened, and it may just be a one-time visit, or check-in. Maybe we're just following up and checking in on how you doing from last week or some things like that. It could be a longer visit depending on what their emotional state is and what, how they're feeling and what's going on in their, that present moment with them. So
Yeah.
it can be,
And there was a new House bill that got um, with Ohio beginning of the school year. So, like with a substantial like change in the students, like we have to let parents know that we met with them. So and I'll tell kiddos like with confidentiality, like unless someone's hurting you, you want to hurt yourself, or you want to hurt someone else, like I gotta tell somebody else. But normally, I'll just call parents because parents want to know who their kids are talking to. I can just I'll call them like, "Hey, met with your kiddo, rough day." You know, and be navigate more like, is it okay if I keep on seeing them? And I also think it just depends on if the parent reached out to you. I think the teacher in what situation, what's going on,
yeah.
I
I mean,
guess.
there's a lot of times I think in elementary school, we're calling parents, maybe not for every visit, but if it's something where, yeah, there's a change in their mental health or their, emotional state, is it significant? Yes. Or if it's something we think it's kind of an ongoing issue or behavior concern, we're going to reach out to them. Or sometimes it's just simple as, okay, who do we call, mom, dad? Like we need to involve somebody else as well.
Right.
So, and I think when it's one of those where we feel like that's going to be more long-term or we need more help than just us checking in on them at school or doing a short meeting with them, um, that's when we're encouraging parents. Like you might need to seek somebody else outside of school, get some counseling, or we have the school navigator, so we kind of offer options to and suggestions there.
And so I guess once you've kind of made that decision and suggested some outside help, what can parents expect from, some of these agencies or practices, maybe on their first visit and how things will go?
I think the first thing is I like to think about this conversation as sort of a wraparound. So if I'm the outside therapist, I want to make sure that, I've made connection with the school and that the parent knows. And then we're also including the student because there shouldn't be anything, about them without them. And so we're going to share this information, and then there's always paperwork involved. We're always going to make sure that everybody signed the right paperwork to be able to share information. But the next step is checking in with the student and constantly equipping them and to making sure that they know how to handle this and they know that they're not alone and they know that many other students have most likely dealt with something similar to this, and that we want to give you the tools and the communication abilities to be able to share with us exactly what's going on. And then we're constantly reassuring that we can work together, that this is manageable, and you just keep growing on whatever that specific situation is. But it's absolutely a team event, and we want to make sure that everybody's on the same page and that we can make sure that that student knows that they're not alone and that we can work through this together.
So I guess one of the things that comes up is like that first, is there like an intake session or, is that something, I guess, is that something, can you explain, does that involve parent and child? Is it just something the parent's going in for? Will the counselor actually meet with their child that day? Because I know I've heard, sometimes it's, well, they didn't even talk to him or we had all this paperwork, so it's kind of like, how does that sort of start?
That for me in private practice, the first visit, and that's one of the first things I say, is we do have to cover these questions. This is important. It's a part of the process. But then it's my job as the professional to make it as least weird as possible. And sometimes I can weave those questions into a regular type of conversation, but I'm constantly informing that student and that parent that this is what I'm going to do on the first time. And then depending on the severity of what we're talking about, then I might have to pause some of that intake and really manage that difficult situation. But ultimately, I mean, it's just what it is. You have to cover those intake questions and sign the appropriate paperwork, because then that creates lots and lots of other problems for you later on. So, yes, there are lots of questions in the therapeutic process. And I mean, it's just what you've got to do. But I'm going to always make sure that my parents are involved with that entire process. And sometimes the parents are sitting there with me, which is a great thing for intake. And then I'm also building what we call rapport to make sure that the parent feels comfortable with me asking that student some difficult questions. And then what I'm going to share with that parent is just what you just said. Hey, these are the things that I have to report out. If you're hurting yourself, if somebody else is hurting you, or you're thinking about hurting somebody else. Other than that, I can share general, ideas of what we've talked about, but I'm going to keep you in connection. And then the other big thing that I like to share with my students is that, listen, if you tell me something, that I have to report out, it's not going to be done in secret. You're going to know that I've got to tell somebody. And if depending on the situation, I mean, I can be there with you while you tell your parent, or I can tell the parent, but the parent's going to know. And I think parents are oftentimes very thankful that I'm sitting in that space. And, I can keep in my confidence that, oh, I like somebody, or that type of situation. But if there's something very major happening, we got to let people know. And that's going to happen. And I relay that to a parents in a way that usually makes them feel comforted that, okay, this is a good thing and this is how the process works.
So it's sort of that blend of, as a parent, like, okay, they can talk about some stuff that
Right.
they feel that should stay private, but if it gets for real, I'm gonna know.
For sure. And that usually involves ideations of suicidality, right? If they're really talking about harming themselves, someone else at home or in other places are harming them. Yeah, we got to talk about it. We got to talk about it. And we're not afraid to talk about it.
I think the community system is unfriendly, and parents just need to understand that and expect that at the front door. It's a business. Everybody's got to keep their doors open, and we want them to keep their doors open. And so, having a therapist sitting and waiting for a need to walk through the front door is not financially viable for any organization to keep their doors open. They have to make money, so they're scheduled. The most credentialed person in the building is scheduled to see patients all day long. So you don't typically get to walk in and see a therapist on that same day that you finally got the courage to walk through the front door. There's a reason for that. It's not personal, and it's not because they don't see your situation as important, but they're serving all day long other families who have already had to walk through that front door. So in the public system, you'll find some agencies have walk-in hours. But unfortunately, it's a misconception that people think that's walk-in for counseling. No, it's walk-in for that intake, paperwork, garbage that people don't want to go through, right? And so you're going to walk in and complete all that stuff that irritates you, and the reason they're going to do that is to get your insurance, and they're going to talk to you about your finances, and they're going to make sure that you get with a provider that your insurance will use. And then they're going to assign you to somebody who's going to do at least a reference, which is the assessment, which is those 650 questions that you're wondering what's going on. Well, it's the 650 questions you answer when you go to the primary care doctor every single time. They are a medical provider. They are billing your health insurance. They have to demonstrate that they have fully evaluated your condition, and this is the condition that they feel warrants more exploration. So to do that, you got to go through those 650 questions. And families are sitting there anxious because they want treatment right now.
Right.
And they don't want to go through this, but it's necessary to go through it. So we have to drop the expectation and know that that's normal. They're not treating you any differently than they treated anyone else. There's legitimate reasons for that. By law, a therapist can't treat somebody they haven't done an assessment on. That's against the law. Then you're treating blindly, and that's negligent. So you're going to come in, you're going to fill out a bunch of paperwork. You're going to be told to come back. You're going to come back. You're going to answer a whole bunch of questions. And then, based on the results of those questions, that allows an organization to know which therapist will better work with you based on your condition. I mean, a therapist in general is not skilled to treat every single thing as well there are some things people specialize in, and if your child needs that specialization, we want to get you to that therapist. So you're going to go through your 650 questions. You're going to get assigned a therapist, and then you're going to go in being the therapist myself. I appreciate the person that asked the 650 questions, but I also have some now I need to ask because we're developing this mutual relationship to try to set you on a journey to get better. And so sometimes it feels like there's even more questions that are being asked. And when are we going to get to the treatment? And so that can be very daunting for families. But if we set the expectation correctly, if we know that you're not going to go down to Ohio State and get a heart transplant without going through your primary doctor, without going to a heart specialist, without going to lab, without speaking with the person who's going to put you under, all those steps have to take place to get that surgery to be successful. And it's very much on a smaller scale, the same thing in behavioral health, but you will get there. You will get there. You'll get to where you're going. You just got to endure the process and recognize that it's there for a lot of reasons and a lot of it's mandates and a lot of it's good medical care.
For sure. I mean, my own experience with therapy, it took a while to get it going.
Yeah,
But the payoff is huge.
absolutely.
It's customized for me.
That's correct.
It all makes sense once you kind of get through that.
Yes. So I think setting the expectations, like for our frontline people to hear this information, for teachers to hear it, for neighbors to hear it, for grandma to hear it, who says, "What do you mean they didn't get to see a counselor yet?" So now grandma's contributing to the challenging ideas that, daughter is having as she's trying to take her daughter. It is what it is. This is the process. Do we wish it could be done differently? I'm not sure. I mean, I wish it could feel differently, but I know that it's set up that way because it's the best way to take care of people. So I think it's just getting the expectation out to the community. So these girls being able to say to the families, listen, I know you're going to start this journey. It's going to feel rough at the beginning. And it's not going to feel personal. You're going to feel robotic. You're going to wonder why you're doing some of the things you're doing. You'll get there. You just got to stay on the journey and we'll get what your young person needs.
The worst thing to say is trust the process, but that's really what it is. Yeah. Yeah, because nobody wants to hear me saying trust the process, but we really do have to trust the process.
There's not a fast track. That's what it sounds like. There's not a fast track.
Really do have to trust the process.
Process is there for a reason.
I mean, the fast track is there for those kids that are highly acute, suicidal.
Right. Yes.
There's the
Yeah.
fast track. There's MRSS. There's the hospital emergency departments. We wish there was something else because there is opportunity to build another fast track for those high acuity kids. But for the child who doesn't reach that level of care, everyone else is going through the same track.
So do you have a lot of parents asking about like video therapy and like telehealth kind of things? And
Well, I think for some parents, there's, work schedules are an issue. They're like, how do I fit this in? Or transportation, maybe there's one car between in a household and there's two people that got to get to work at different shifts, different times. I think transportation and finances I hear that is kind of a struggle sometimes. Like, so it's, I don't know if that's an option for kids. I mean, I think there's options out there. I'm not real informed on them.
to our expert, are there options, and is that a good option for a child?
So oftentimes, teletherapy or telehealth, in my space, we don't go beneath the age of 16. It is sometimes an option, but oftentimes I also want to always share that telehealth can be a challenge because there's no way that we're really guaranteeing confidentiality. We don't know who's in the room. We don't know if there's, stable internet. There's just a lot of other factors that go into that. I personally really try to avoid that in all cases. But it's a challenge. And so we do understand that transportation and all of those things are a challenge, but I'm always going to say, please, let's work together and find a time that does work out for you because I want to see your student in person. That's what I'm going to push for. There may be other community options that are available, but I really try to avoid teletherapy.
And I think in the public system, we recognize that, I mean, we're in a shortage of labor, right? We don't have enough workforce. And so if you, particularly psychiatry, I've told this community since I've been here, the fact that we have a child psychiatrist in our community who's been here and committed to our community as many years as he has is a blessing not every community has. But he's one person. And so it is more efficient sometimes to make him available through telehealth. So he can serve Hardin County, he can serve Auglaize County, and he doesn't have to waste
Travel time.
significant amount of time on the road, right? And physicians are using medication and they're doing symptom management. So that is, uh, I believe, very capable of being assessed through telehealth, right? Child's going to tell you if they're sleeping. They're going to tell you if they're eating. Mom's going to be able to tell you if they're sleeping or they're eating or they're having outbursts. However, telehealth and counseling has been found to be effective with kids to a certain age. Um, in today's world, kids feel comfortable in their own space, in their own room, using electronics to communicate to other people where that doesn't work for me, but it does work for kids. It has been found to be effective to eliminate those transportation barriers. Um, so I think it's again, as Lisa alluded to, working with the family. What are we comfortable with? Exploring what the young person is comfortable with. If they're not, it's not a useful tool. Don't do it. If they are willing to try it, something is better than nothing. And if the barrier is going to bring nothing because you can't overcome it, then we're going to try it, right? Because we're going to believe this something is better than nothing. And I think it's families. I mean, parents are so important for children. It's how we choose to address it and to communicate about the stigma around treatment. And also recognizing that we should be saying to our young person, it's never about you going to get treatment. It's about us figuring out what's creating these issues and how us as a family can heal from it because we're all hurt by the issue. So we all got to heal by the issue together, right? This is a together thing, but it's starting with the nucleus. So that's why you're in the office and then we're only coming in to participate and learn what we can do to support you and learn what we need to not do that's been hurtful, right? But the other thing I tell parents, and I want to make sure I say this, it is like going to a general practitioner. You can go with 6 different medical things on your mind. I got high blood pressure, I'm overweight, border diabetes, whatever. But today I broke my foot, and that's the urgent situation in front of me. I can go to the family doctor to address my foot. It does not mean I have to address all those other surrounding issues in that appointment. I think families are concerned and kids are concerned that they're going to have to go into a counselor's office and expose every dark, deep wound, every dark secret that's ever happened. They're afraid if they tell that their mom yelled at them that somebody's going to think they're being abused and that we're going to ask all these questions to get this big holistic picture. No, we're going to focus on what the child and the family wants to focus on. And if that's one issue, that's what we address. If it's your failing to be able to behave in school, that's what we're addressing. We don't need to talk about whatever happened 5 years ago or 6 years ago or your deep wounds. If you're not ready to address that and your family isn't ready to address that, but we're going to focus on what's preventing you from being successful today. Many of us never heal our child's wounds. And so we're adults, right? And we're safe and we're capable and we're ready to. So we don't put kids in a situation where we open up these wounds that they're too young to manage, that they're not getting the support or they're afraid or whatever have you. So I just want families to know that we're not in there digging for every single thing. We're addressing what it is you want us to address to help your young person be successful in the moment.
So sometimes I think kids or families get into therapy or counseling and they might say, I don't think this is working, or all they did was play with my kid. I don't understand, what are you actually doing in there? What am I paying for? What are some responses to that?
Oftentimes, play gives us an enormous amount of information. First of all, it it occupies, especially depending upon the age of the child, it occupies their hands. It gives us something else to focus on. It takes the sting out of saying something really difficult. And so I use something called the ungame a lot. And the ungame is just that. It's a board with some pieces, and it's asking questions that's giving me information, but it feels like a regular board game. I use Legos a lot with little, and sometimes big kids because again, it gives our hands something else to focus on, and it gives us a lot of information. But I share that with my parents. You know, they might say they only played Legos today, but this was my goal. The kid built a robot or whatever, but this is what I was looking to get out of it. And so partnering again with the parent to make sure that they know that yes, we did play a game, but I was also gleaning other information is sometimes helpful. And then the parent knows that when the child comes home and says, I just built a robot in therapy, I didn't do anything, then the parent can say, oh yeah, but Lisa was working on X and so. So that is very helpful. But there's a lot of tools that we use in the therapeutic process that that may seem like one thing but is really very much something else. So I try to inform everybody of what's happening when we're using those types of manipulatives.
Yeah, I think that's so important is that families do, you don't have to say have to trust because nobody has to do anything, but that the therapist has to document for the health insurance, regardless of which health insurance it is, the board, Medicare, Medicaid, private insurance, the intervention, which must be evidence-based, which play therapy has significant amount of evidence behind it, the purpose and the intervention, and the outcome of the intervention. So it seems like play, but you have to trust that, clinicians aren't going to school and spending enormous amount of money and 6 years of their lives to sit in an office and play Legos with a student or a child if there isn't some value in that. And therapist isn't responsible enough, like Lisa, to share that with them up front. They need to ask this is what I was told happened. It feels awkward to me. Like, was there any benefit to that? Because especially in community practice, they're booked every hour, right on top of one another. And sometimes if you get behind, then you're not taking that time to be as communicative as you should be with family members. But if you didn't like what you heard from your child that happened in, by God, what I'd be doing is emailing because I'm all about put it in black and white, right? So all my email was open to everybody, all family members. You can email. It doesn't mean I can email you back without a proper release of information, but it doesn't prevent me from receiving information. So here's my email. Blast it on the bathroom wall. Send me any information you want. The other thing that I'm going to say, and this isn't real positive, the clinician is only half of the issue in the office. The youth has to be open at some level and willing to receive what's being offered, willing to learn a new skill, willing to learn some insight, has to really be willing to participate. Therapists can't force children to get better. I mean, if we could,
Everybody would be well. For sure. Everybody would be well.
children, they are their own human selves, right? If they are absolutely refusing to benefit from the time and the investment that's being made to help them, it isn't the clinician that failed. It may not be the right time for the young person. They may not feel safe. They may not have had developed a good relationship with the therapist. Maybe we try to inquire with our young person why they're not seeing any benefit to see if there's something we can do about it. But to blame a clinician is really a bit dangerous because then we give up on the whole practice that kids can get better by going to counseling when in fact that young person was sitting in there very defiantly. Now, it is our responsibility as clinicians to try to turn what we call an involuntary patient into a voluntary patient through developing a relationship with them and developing rapport and trust. But at the end of the day, I've had many individuals sitting in my office because they've been court ordered or their spouse has threatened to divorce them if they don't go, but they're not in there to really receive and benefit from what I'm offering. It was not because I failed to do what was required of me. It was the person who's has equal influence into the outcome did not want to do what they needed to do. So we do have to own that. I mean, we cannot keep putting it on counselors. Children, that's why it's so important for us to reduce the stigma. It's why it's important for us to normalize getting help if you need it. Why it's important for all of the people that influence that young person's life to be on that treatment team if we can get them on that treatment team. So we're really promoting their growth, promoting rewards, seeing when they've made progress. Because if we don't do that, kids are just shut down.
Sure.
And you can't blame the clinician on that. You just can't.
Something that I like to ask the parents to do is throughout this process is please work with me by changing your language. And when Tammie was just mentioning changing the stigma, I think something that parents can do is to, if that child or student is kind of ragging on, well, I only go there and I only built a robot, for the parent to say, in that reaffirming voice that I'm trusting this process and you should too. So that's one thing that parents, please help us with this, and don't get on the bandwagon of being negative with your student, because that's not helping us. Because then when the child comes back in our space, they're empowered to say, well, my mom even said, nope, that's not what we're doing. So we're working on this goal. This is what we're working on, and we're going to keep moving that forward. So parents, please help us in that space by reducing that stigma of what's actually happening.
I know a lot of therapists, counselors, teachers, they rack their brains of how can I how
Yep.
can I crack
Yep.
crack this case? How
Yep.
can I make this
Mhm.
child better? So yeah, I'm on board with you there.
Going back to they just did this, they just played. I've experienced, calls with parents and guardians when the children are a little bit older and they refer back to, well, when they were in this grade or when they were this age, they just played and it didn't work.
Yep.
And I'm like, well, maybe now they're old, it's kind of like trying to get them back in that,
And really, they don't know that it didn't work.
so it's kind of like sometimes they've tried it for a little bit and then a couple years later, we're back in the same boat or in a new boat going, now what, and how do we try to give that, I guess, encourage them to give it a chance again or to find somebody else or
Because that student isn't the same, in the 6th grade that they were in the 3rd grade. And so we keep trying to crack the code and keep moving forward. So absolutely.
Yeah.
Yeah.
I mean, absolutely. I mean, it's a medical intervention, right? And us as adults, even, we try one thing the doctor told us to do, it didn't work, we try the next thing that the doctor tells us to do. And there's different points in our life where we give up and it didn't work, we walked away from it, and 5 years later we're now fully committed to it, and we go back and we try it again, and oh my god, it worked, right? So a lot of it is about commitment and investment and involvement. But I think that um, when you set a very clear goal for kids, when you let them set their goal, like I have to come here because, I'm about to get expelled from school or, whatever have you, and I don't want to get expelled from school. If you can get that goal, then you can get them working towards something. But when we're sending them and we can't communicate to them how they can benefit from going, then that's the trouble, right? We want to say to them, we don't know what's wrong with you. That's what we're going to find out. No, we do know what's wrong with you. We know that you have anxiety. We know that you won't go to school because you're afraid to go to school. We know you're not failing in school because that anxiety is getting in your way. Like being very specific and not just it's this deep dark mystery about what I'm going to counseling for. But listen, you talk about not you feeling sad all the time. Your friends aren't feeling sad all the time. That's something most kids don't feel all the time. So let's go see. Is there something that we can do so that you're not feeling sad all the time? Like really the more focused you can get kids on why they're going to counseling, it becomes less mysterious and less frightening for them to go in there. And then they've got something they're focused on, and kids are typically goal oriented.
Let's say a student has, you know, taken some steps to either talk to a navigator or either of you. What does kind of success look like when they're working with you? And then what does success look like if they take the leap to therapy?
Mhm.
So
I think it kind of just depends on what they're coming to see us for. Like if it's behavior, let's say in a classroom, success to us is not getting a call from the teacher. You know, if because I've had some kiddos where I might see them every day. They're in the classroom, can't can't function. Upset, and then the next year, like I won't get anything. I'm like, oh, they're so good. So I think success is just when teachers don't need us, or even with um, the higher level kids, they're not asking to see me. Like if I'm putting more independence on them and they're not, asking the teacher, can I see Miss Foley, 3 times a week, maybe it's once a week. To me, that's like with success.
Mhm.
Yeah.
Yeah, I think too, like use along those same lines too, like they're using those coping skills that we're working on them with, or it's the organizational skills I'm trying to help them with. It's getting them to, manage their emotions. Are they doing that better? Are they having less was maybe it's outbursts or talking back or, saying things to other people. So I guess, it's like we see the decrease of need where I guess it's the increase of their skills, because we're not getting yeah.
Yeah, that's something that I work on personally is kind of having that toolbox available to me. How can I
That's my word.
Yeah.
Yeah, or like maintaining more time in the classroom. They're on task. They're not being out of the classroom. They're not trying to avoid things. They're on task more. They're completing things. Their grades are improved. Or maybe they can get through recess or the day, the week without having conflict with others. Managing their own emotions and what they're saying.
In a private space, I'm always going to be referring back to their therapeutic goal sheet and how they can build their toolbox and then how they can relate to me how they're managing the same situation. If it's, 6 months in or out, whatever it might be, then I'm looking for if you were in the same situation that you were in today than you were however many months ago, how would you handle it now? And do you feel empowered? I look a lot for empowerment, especially in confidence, in having difficult conversations, and to being able to recognize what their feelings and what their challenges were. So if you can articulate, well, this is what I'm feeling, and because I felt this before, I know what to do now, then I count that as a success. And so if they can articulate, what's happening and what they're going to do for it themselves, because I've part of my goal is to make sure that they know how to handle it if that challenge comes up again. And so I'm using their therapeutic goal sheet as a check mark to say, this is what the problem was. This is how we handle it. And do you feel empowered going forward to work on it on your own? And then also, you also are very comfortable in knowing when you need to come back to me or when we need to involve someone else.
So Tammy, there might be some more acute situations where maybe the emergency department is needed or some really short term got to get on this. What does success look like there? Um,
Well, it's never simple, but keeping kids alive is always in hand and safe, right? So we know that even though some kids are still waking up every morning, the um the thoughts are still there. So, trying to keep them as safe, getting them as medically stable as we can so that they're not burdened by those symptoms. Um, but really it's our first goal is always keep kids alive and then we grow from there. Like now we've got you where death isn't an option anymore, and we can all agree on that in those acute situations. What do we need to do to wrap you to keep you safe when those infiltrate your mind? Who are you going to go to? Who are you going to let know those thoughts are here so that we can wrap and protect you from your own thoughts? And then once we get all that stabilized, you can get more into ongoing skill building, but it's for many of our kids, it's surviving with them in the moment that's most desperate, and then hoping that they understand that people cared enough to respond to their situation and came along the journey with them, and that there's a light at the end of the tunnel. It's not easy, it's a journey, but it's there. It's there. I try to tell kids, listen, you got the best of both deals here. You're only going to be a kid for 18 years. You're going to be a freaking adult for 60 or 70, right? So don't give up in this time frame on what you're experiencing here, because it is not going to last forever. It will end. And those things that you're wishing you had now, they're going to come and you're going to wish differently later on. So it's situational. Kids are so reactive. We take every self-injurious thought seriously. And, we'll hear parents say, well, they're just saying that to get their way. Well, that might be, but most kids don't.
Yeah. And we can't afford to take that gamble.
Right. And I always talk to parents about using social norms. I actually raised my kids this way. If you look around the classroom and nobody else is doing it, it's probably not socially acceptable for you to do it either. So I talk to parents. If the majority of other kids are not saying those things to get their way, because all kids are trying to get their way, if they're not saying those things, this thing separates them and it needs to be taken very seriously. And while there might be an exception where a kid has just learned that those trigger and mon reacts and, whatever, okay, that's fine. Let them win. Let them win, but I'm not going to take the chance that I don't respond and someone else loses, right? So we're always going to respond to those thoughts and those comments very seriously. And then we're going to turn them over for long-term healing. What I do want to make sure that I say, though, live here is that in Ohio, I want parents to know that children that are 14 and older can give their own consent for mental health treatment for a certain number of sessions and a certain number of days. And 12 and older can give consent for substance use treatment right now in Ohio under the rules for a certain number of sessions and a certain number of days. It's very limited. And I know that makes some parents angry. But if you're a child and you recognize that you started using substances and you don't want your parents to know, but you want to stop and you want to get help, none of us want to tell our parents that. And what we don't want is a barrier for them to be able to get what they already recognized, thankfully, that they need. And have a venue to get there. Now, if it takes longer than what the law allows us, then we have to bring the parents in. There's safety guards in that. Or if we have a kid who is suicidal but doesn't want their parents to know that, we do not want them to not be able to consent for someone else to intervene and help keep them well.
Yeah.
But it's limited, it's protected, but it's real and it's there. Now, currently, there's House bill out there that's countering that, and for good social reasons, right? Parents now want to know everything about when their kid gets into treatment and what they're doing in treatment, and I understand that. But there's laws coming to protect that certain things cannot be addressed with youth without parental permission, and it shouldn't be then, right? I mean, the law says you can't, then you don't. And no therapist should be addressing something that significant that's going to be that long-term without parental involvement anyway. But we know in every field there's those that test the boundaries and not. So I'm not going to protect the whole field. I do want parents to know that kids can do that. And I want kids to know that.
Yeah. How does a kid kick that off? Who do they talk to? Who do they tell?
It's hard to get that information to kids. We're very fortunate that we have like a youth drop-in center where a lot of kids are familiar with, and they will go down there and they can get some supportive services that they need. But say these young ladies see a youth in their office and they're going to follow their school policies, which is a whole nother set of world of policies, but they can inform a student. Like, if you really need to talk to a counselor and your mom is refusing to take you, or your dad is refusing to take you because they have their own stigma about that, you can take yourself if you're 14 or older for this many sessions or this amount of time. We should be empowering kids to do that. Or if it's substance use related. I'm going to get a lot of backlash about that from parents, but it's the truth. It's the law. And I believe it's a tool that young people need to know is available to them if they don't live in an environment that supports what they're asking to get.
Well, this has certainly been informative for me. I hope it answers questions.
Yes, it's been wonderful. Thank you.
I think I want to close out with just, reviewing some of those resources that are available to parents, students, other social workers, therapists in the community. So Tammie, this is probably your time to shine here.
As I said, getting on the internet is helpful, but also overwhelming. So you can go to the Ohio Department of Behavioral Health, and they do have what they call a treatment provider map, which you can zero down in by zip code. And they will tell you the organizations that are certified by the Ohio Department of Behavioral Health. And I won't bore the audience with that, but what that means likely is they're a Medicaid provider. So, but again, agencies that serve Medicaid also serve third-party insurance and Medicare. Again, you can go to our website. We have a way for you to message us through our website. You can call us at the board. Our number is on there. The one thing we don't do is not respond to the needs of our community. The 988 crisis line, it is an information referral line as well. Now, we're blessed in these 3 communities. It's not this way across the state of Ohio, but it is for us. The 988 operator sits in the same room as the Hope Line operators that the board funds. So there is no transferring. They are equally informed about local resources as our Hope Line operators are. So if you can't remember the Hope Line number, which is 1-800-567-4673, 988, and you're gonna get that information met and available to you. And then we also, for family members of people who we already know have mental illness with their youth, NAMI is an amazing resource. And Lisa can give you all the information about NAMI, but
We're going to talk about that later.
NAMI is a great organization. But here's the other thing. You should be able to call your health insurance, the number on your card, if you have health insurance, and ask them where they're contracted with and local providers, or you can call your primary care physician, because they know that. They at least know the first door to send you through. What you don't do is stop asking.
Yeah. Right.
Keep asking. Ask someone. Ask these girls. Call the principal. Call the superintendent. I don't care. Go to school board. Some professional out there is going to be able to send you to the first step, and then that person might send you to another step. But you keep stepping, and eventually you're going to get there, because none of us sitting in this room know all the resources that are available in our community. I mean, I hear about amazing little gems in the community, and I'm the board director, and I'm like, really? When did we get that service here? So
resources are out there. Thank you both for joining the show. Thanks to Bat Schools.
yeah, absolutely.
Thanks for having
Thanks
us.
for having us.
Thank you for the wonderful idea.
Yeah, they're right. Thank you for
Much appreciated.
So thanks again, everyone, for tuning in, and follow the Mental Health Board on Facebook and Instagram at We Care People, and we'll see you next time.